It is uncommon to see a completely empty and collapsed stomach in a dog because dogs tend to swallow air even if not eating. There are actually 5 layers of the stomach wall, but we only measure 4 layers. The innermost layer is an irregularly thickened layer of hyperechoic mucus, produced by the mucous membrane layer to protect the stomach from gastric acids and mechanical damage from ingested food. This hyperechoic inner layer of mucus should always be present, but it is not included in the wall measurement. This video begins with the gastric groove of the feline stomach. Longitudinal muscles on both sides allow the groove to close to form a tube, so that liquids can be passed directly to the pylorus and duodenum. The fundus and body of the empty feline stomach often resemble a rosette pattern. It is common to see a completely empty feline stomach because cats do not usually swallow air. Remember that the cat stomach does not extend as far to the patient's right side as the dog stomach. Note that all 5 alternating hyper and hypoechoic wall layers can be seen. Abdominal ultrasound is more informative if the patient has been fasted and the gastrointestinal system is empty of food and gas. In this video, the ventral stomach wall and rugal folds can be seen. All wall layers are distinct, and gas artifact develops distal to the mucus layer of the stomach wall. Little can be seen of the dorsal stomach due to the ingesta and gas artifact. Even if a dog has been fasted for 12 hours, it is common to see gas artifact in the canine stomach. Note that all 5 wall layers are present. Also note that the gas artifact occurs distal to the thick, hyperechoic mucus layer of the stomach wall. When filled with food and gas, the normal stomach may obstruct the view of the liver, gallbladder, and any organs dorsal to the stomach. Delayed gastric emptying is suspected if food is retained in the stomach for more than 8 hours. The laser light line on this abdominal graphic represents the ultrasound beam with the transducer in a ventral sagittal position over the patient's right side of the stomach. Slide the transducer to the patient's right side till the stomach disappears. Reverse directions until the stomach begins to appear again. Rotate the transducer to a transverse position and fan slightly cranially and caudally until the lumen of the duodenum connects with the lumen of the stomach. The pylorus is the place where the lumen of the stomach and the lumen of the duodenum connect. This video clip demonstrates the ultrasound appearance on a live patient of the transducer movement you just watched. The stomach gets smaller and smaller as the transducer moves to the patient's right side. Then the duodenum is seen. The transducer is rotated to a transverse position and fanned slightly cranially and caudally till the lumen of the duodenum connects to the lumen of the stomach. The pylorus is between them.